All right, let's dive right into this explainer. Today, we're mapping out an absolutely incredible internal network. Whether you're just starting out or you simply want a rock-solid refresher on how your body actually works, mastering the veins of the lower limb anatomy is totally essential. I mean, it can definitely seem complex at first with all the different routes and heavy medical terms, but we're going to break the whole thing down perfectly for you today.
I want you to think about this for just a second. How exactly does blood travel from your toes all the way back up to your heart, defying gravity the entire way? It's a massive upward journey back home. See, your arterial system gets to use the sheer pumping force of the heart, plus gravity, to push oxygenated blood down to your feet. But the venous system? Well, it has to act like this complex anti-gravity transportation network to get that deoxygenated blood back up. Let's map out how it actually pulls this off.
So, looking at the broad map of the lower extremity, the veins draining the lower limb are essentially divided into two main groups. As we trace the pathways from the foot upwards, you'll encounter major players like the great saphenous vein and the femoral vein. But here's the key thing you need to keep in mind. All of these routes, no matter where they happen to start in the leg, ultimately flow upwards to continue as the pelvic veins. From there, they flow right into the inferior vena cava, which is that massive central trunk carrying all the collected blood straight back to the heart.
To really wrap your head around this, I want you to use a super simple analogy. We divide the leg veins into superficial veins and deep veins. Think of the superficial veins, which sit right in the subcutaneous tissue just beneath your skin, as your local surface roads. They're just collecting blood from the immediate local area. On the other hand, the deep veins? Those are your major underground highways. They run deep beneath the deep fascia of the lower limb, and they are carrying massive volumes of blood.
Now, obviously, these two systems don't just work in total isolation. You can't have local roads without on-ramps to the highway, right? Well, in anatomy, we call these on-ramps communicating veins. These are essentially anastomosis, which is just a fancy word for biological connections that allow blood to safely transfer from the superficial surface network deep down into the underground network. They're absolutely vital links that keep the traffic flowing efficiently.
Section 1. Superficial veins, the surface highways. Let's hit the road and look at the two major superficial veins of the lower limb. Think about the sheer length of this first structure. Starting from the medial side, the inner side of the foot, it travels all the way up the leg right to the top of the thigh. This is the great saphenous vein. It's the longest and arguably the most famous of our surface roads. It originates specifically from what's called the medial marginal vein of the foot, and it collects venous blood from the medial side of the foot, the lower leg, and the thigh. Now here's where it gets really interesting when you track its exact route. The great saphenous vein actually acts like a travel buddy. As it ascends the medial leg, it travels right alongside the saphenous nerve. It just keeps going up the inner thigh until it reaches a specific opening. At this point, it dives deep. It pierces the cribriform fascia and officially joins our deep highway system by draining directly into the femoral vein. It's a perfect example of a local road finally merging onto the interstate. Then we have the other major surface road, the small saphenous vein. While the great saphenous vein handles the inner leg, the small saphenous vein handles the outer and back parts. It starts over at the lateral marginal vein of the foot. It ascends along the posterior side, the back of the lower leg, and this time it's traveling with the sural nerve. Once it reaches the back of the knee, it pierces the popliteal fascia and flows right into the deep popliteal vein. Section 2. Deep veins below the surface. All right, let's physically shift our focus spatially from the skin level down into the deep tissue. It's time to map out those underground highways. This part is actually often misunderstood by beginners, so let's clear it up right now. When we talk about deep veins, you might naturally picture a single large pipe. But actually, most deep veins in the lower limb are what we call binary. They're paired veins known medically as venae committantes, which simply translates to accompanying veins. They literally wrap around and travel right alongside a matching artery, and they even share that artery's name. To turn this static anatomy into a dynamic process, let's trace the three major steps the blood takes as it gets pumped upward through these deep highways. Step 1 begins down in the calf with the anterior and posterior tibial veins. Step 2 occurs when they merge at the back of the knee to form the popliteal vein. And finally, Step 3 happens up in the thigh when it becomes the massive femoral vein. Let's break each of those down. Starting way down in the lower leg, we have the anterior tibial vein. Anterior just means front. This paired vein starts from the dorsalis pedis vein in the foot. It ascends right up the interosseous membrane of the leg, which is just the tissue sitting between your two shin bones, and it collects blood from your ankle joint, your knee joint, and the entire front portion of your lower leg. On the flip side, literally, we have the posterior tibial vein. As you've probably guessed, this one handles the back. It's a paired deep vein that arises on the plantar surface, the sole of the foot. It ascends through the cruopopliteal canal, collecting venous blood from the posterior compartment of the leg and the bottom of your foot.
Section 3. Merging the networks, femoral and popliteal veins. So we've got blood traveling up the front and back of the calf. Now let's move up to the knee and the thigh to see exactly how these networks merge into those massive singular trunks.
Right at the lower border of the popliteal's muscle, behind the knee, the anterior and posterior tibial veins finally unite. They actually drop their binary, paired structure and merge together to form one single, large trunk, the popliteal vein. This vein then ascends through the popliteal fossa, collecting blood from the knee joint and the calf muscles, basically acting as the main upward conduit for the entire lower leg.
When you compare the superficial and deep networks, it all ties together so perfectly. The popliteal vein travels up, passes through a space called the adductor canal, and officially becomes the femoral vein. It's right here in the thigh that the superficial great saphenous vein officially dumps its collected surface blood into the deep femoral highway. Again, it's just local roads finally meeting the interstate.
And that brings us to a really crucial player, the femoral vein. This is the large blood vessel of the thigh. It accompanies the femoral artery, traveling safely tucked inside the femoral sheath. It's busy collecting blood from the muscles and skin of the thigh, traveling all the way up to the inferior margin of the inguinal ligament. And the very moment it crosses that ligament into the pelvis, it actually changes its name. It officially becomes the external iliac vein, continuing its final journey to the inferior vena cava and ultimately back to the heart.
Let's quickly lock in our mental map with these key takeaways. The lower limb relies on two main systems working seamlessly together, the superficial and the deep. Your major surface roads are your great and small saphenous veins. And your deep upward highway system flows sequentially, starting as paired tibial veins in the calf, merging into the singular popliteal vein at the knee, and finally becoming the massive femoral vein up in the thigh.
The biological engineering required to push all that blood against gravity, utilizing muscle pumps and these highly specific venous pathways, is honestly nothing short of an evolutionary marvel. The next time you go for a simple walk, think about the millions of valves working tirelessly in those underground highways just to push that blood back home. So, which vein of the lower limb do you find the trickiest to remember? Let us know in the comments, and make sure to subscribe for more simple medical explainers just like this. We'll see you on the next explainer.